pleased to have Dr. Ben Miller join us this evening, who knows Wolf Ridge, is helping colleges and universities as an epidemiologist to navigate all of the same sorts of conditions to help us tonight understand some of the changes and some of the lessons we can learn. Dr. Miller, Ben, welcome.
Thank you, Pete. Appreciate it. I'm going to share my screen here. That should pop up. We'll go like that. And it is a pleasure to be here. As Pete said, things have been changing quickly. I think, Pete, you and I are introduced by Ann Haddad, another Prairie Creek parent, back at the beginning of February. And when we think back to February, where we were, case rates really throughout the country were exceedingly high. We'd started to roll out the vaccines to care workers back in December. We've seen the effect that those vaccines have at a population level in terms of reducing illness. And it's, I think, one of the success stories of this pandemic. Being an epidemiologist, my background worked in the Minnesota, well, I'll go through that in a slide here in a second, but it's a pleasure to be here. And I'm going to talk a little about the science, just behind what we've learned around COVID, and really how that's informing policy at places like Wolf Ridge. So I've worked with Pete to review his reopening manual to make sure that, you'll see some of the recommendations that are, or the requirements that are in this reopening plan are maybe a little more stringent than what the state's requiring right now. And I think there's good reason for that, but pretty well in alignment with some of the changes that we've seen. The changes have come quickly, just really over the last couple of weeks in terms of CDC coming out and if you're fully vaccinated, you no longer need to mask, really, regardless of something. I think that was a little for a lot of people, caught some people, I think, including a lot of epidemiologists, by surprise. But I think there's reasons for why they made that decision as well. So we'll go through that here. But just a little bit about me. This is my family, my wife, Deborah, son, Theo. That's the fifth grader at Prairie Creek. Daughter, Harper. She is a Prairie Creek alum, now in eighth grade here in Northfield. Dog, Leon. Leon has never been to Wolf Ridge, unfortunately. He's too young. So, but we have been, had the chance to go up with Harper, and you'll see a picture of her here in a few slides, 3 or 4 years ago when she was in fifth grade at Prairie Creek, and looking forward to being up with Theo later in June, as Michelle mentioned. But my background, I've worked at the Minnesota Department of Health as an epidemiologist, and spent some time at the Minnesota Department of Agriculture in the state of Minnesota too, really working on a variety of infectious disease outbreaks. Later in my career, the focus was more on foodborne outbreaks, but a lot of the same principles apply. And so no one ever wants to live through a global pandemic, although being an infectious disease epidemiologist, you find that your phone starts ringing when those things happen. And so it's really been a privilege to help companies, schools, colleges really navigate sort of the complexity of COVID over the last year. And at the same time, I'm ready for it to be over too. So I'm excited about getting back to our new normal. So I'm just going to outline what we're going to cover this evening. We're going to talk a little bit about what we've learned around routes of transmission, masking, the fact that testing matters, and I think testing will still matter here in the future. Ventilation, that's I think one of the misses of this pandemic overall. It's just that we failed to understand the importance of ventilation early on. Talk a little bit about the vaccines, and then what does that science tell us about how we want to do things at Wolf Ridge at the beginning of the summer. So we've learned over the last 15 months that surfaces really aren't the primary route of transmission, and in some ways we should have known that early on. There was a choir outbreak in the state of Washington back in February at the very beginning of the pandemic, where one person in the back row, the back corner, was infected, and lo and behold, 32 other people were infected by that one singer. They had, I think, a 2.5 or 3 hour long choir practice, and massive amount of infection there. That should have been an early clue that we weren't dealing with something that was primarily transmitted through surfaces. Although we saw a lot of guidance come out around surfaces, and I'm sure we all remember, do I clean my groceries when I bring them home? We wiped down every surface, washed our hands many times. Not that hand washing is a bad thing, that's a good thing. We want to continue to do those things. But we should have probably focused on ventilation and matters like that. And that tied into, recommendations on masking. Obviously, we started maybe on the wrong foot back in March, especially in this country in terms of the messaging around masking. But we are where we are. So, as I mentioned before, the primary routes of transmission, CDC just a week ago, or about a little more than 2 weeks or a week and a half ago, updated its website to really reflect the fact that inhalation is really the primary route of transmission. And deposition of virus on surfaces matters to some extent. So it's not that it's zero risk, but it's definitely not the main route of transmission. Being close to someone who's symptomatic, like in the case of the choir outbreak, yes, that absolutely matters, and that certainly represents a high risk setting. But really, I think what you'll see going forward, just in terms of general public health guidance, but also at Wolf Ridge, is really that focus on masking indoors, and really a look at the ventilation systems and putting people together who should be together indoors. The other good news is that it's not transmitted through food. So there's Harper serving up cinnamon rolls in the Wolf Ridge kitchen when she was up there. Good news, we figured this out, I think, fairly early on. There's been some controversy around that, but generally, or even more than generally, we don't see transmission through food. So the good news is that dining halls can be open, self-service open. Again, hand washing is a good idea regardless. That was true before the pandemic, and that's certainly true after the pandemic. But you'll see and have access to the meal hall when you're up there this summer. The other thing that we learned was masking works. There's a lot of research done on just sort of the effects of covering, especially when somebody's infected and asymptomatic, and that's can be particularly true in a younger age group. We know that asymptomatic infections, or people that don't experience symptoms, skews younger, and the older you get, the more likely you are to have symptomatic illness. So masking indoors, especially for kids, and especially for kids who aren't old enough to be vaccinated, is still going to be, at least for the time being, an important risk mitigation strategy, places like Wolf Ridge and in other places in general. Testing matters. This is kind of what we would call the epi curve, or the epidemiologic curve, that shows the case rate over the entire course of the pandemic for Lake County, where Wolf Ridge is located. And so when we see, this corresponds to November and December of last year, a real spike in cases. And that case rate has come down, but it's because we've had good, solid, widespread testing now associated with the pandemic, that we're able to really make sure that if anyone has a symptom, that they can go and be tested. And that's important because we want to remove people who are just becoming symptomatic, have them isolate, have them spend 10 days not in close proximity to others who are unvaccinated, so that we can really start to cut off that transmission of illness. And so right now, the case rate in Lake County is quite low, 6.7 per 100,000. We worry about, certainly when it gets above 10, and certainly when it gets above 25. And Minnesota was actually still above, at a state level, 25 cases per 100,000 several weeks ago. We've really seen that come down as the vaccination rate in the state has increased. So that's good news. I think the big headline is ventilation matters. We've figured that out, and there's really been some good research and modeling that's gone on around ventilation. I think one of the interesting papers that was published out of MIT about a month ago, been submitted all the way back in September, and it went through a pretty rigorous peer review process, but shows us that the 6-foot rule may not really be as effective as we thought. So we needed kind of a model or a rubric by which we would say, okay, who's a close contact? And so for a long time, at the beginning of the outbreak, we decided that 6 feet for 15 minutes really was representative of being close enough to somebody who, if they were infected, it was possible that you could be infected too. And so then somebody who was close needed to quarantine because they were a close contact. But modeling and just more looking at transmission of disease, I think what matters more is mask usage, ventilation rate. So if you're going to spend an extended period of time or even potentially a short period of time indoors, what's the ventilation rate? Is the air moving? Is it being filtered? Are you exchanging that air with fresh outside air? And then what's the vaccination rate of the population overall? Those are the things that are going to matter more going forward. And vaccines. I mean, one of I think the big success stories of this pandemic, we went in rough about 10 months and developed vaccines that were safe and effective, really building off a technology platform that had been in place and being researched for 20 years. That the technology that these vaccines come from isn't necessarily new. The speed to market was new, and I think that caused some concerns for people, and still does. The reality is we've administered, over 100 million doses of these vaccines in the U.S., and really, we have a very robust surveillance system to look for adverse events. And what we've seen is that, especially these mRNA vaccines, and those would be the Pfizer, the Moderna vaccine, quite safe and very effective, even against some of these new and emerging variants that we're hearing about in the media. So right now, the Pfizer vaccine is authorized to be used in those 12 and older. That's great news. That means that younger adolescents can start to be vaccinated. Now, that will definitely cut down on case rate and transmission in middle school age and above. And we do know that these vaccines are effective. There was a recent CDC study that really looked at this sort of in the wild with healthcare workers and essential workers. People who were vaccinated were 34 times less likely to be infected than someone who is not. We know that these work well, especially out in the real world. And we are seeing early data, too, that these vaccines help people, especially people who aren't symptomatic, from spreading COVID. We're still learning about their effectiveness in those who are symptomatic, but very low rates of who have fully vaccinated ultimately go on to develop any kind of symptoms associated with COVID or be infected. So how do we translate that policy to what's happening on the ground at Wolf Ridge? Well, some of the things that the reopening guidance or requirements will include are unvaccinated or partially vaccinated people will be asked to test 72 hours within 72 hours of arrival and demonstrate a negative test before arriving at Wolf Ridge. Because children who are less than 12 aren't currently vaccine eligible, everyone will be asked to mask indoors in common spaces. So as you go into the meal hall, wear a mask. Once you sit to eat, obviously we would take off the mask, and you can't eat through a mask even today. So, and some of those common spaces in the dormitories, if you're in the dorm with your family, that mask can come off. You're obviously close contacts with whomever you're there with already. Regular symptom monitoring is still going to be important. And that is one of the things that I think will carry forward and probably into the next and coming school year as well. Is we want to know and really look at, make sure nobody has active symptoms. And if they do, we want to get them tested as quickly as possible. And the good news is that rapid testing for symptomatic people are available now in Two Harbors. So you can, within an hour's drive of Wolf Ridge, we'll have rapid testing available where you can get somebody who's symptomatic tested and get the results back quickly. The other good news is that the Wolf Ridge, many of the buildings there are well ventilated and have really good filtration already. So MERV level 13 filtration, which is great. A lot of buildings, typically only have sort of level 8 or maybe a level 10 for filtration. 13 is kind of viewed as the sweet spot. It filters out about 70% of small particulates, and so as that air is recirculated, you're really removing a lot of the size of particles that could cause illness, in an indoor setting. And there'll be use of natural ventilation as much as possible. So in some of those buildings where maybe the filtration isn't as high, say the dining hall, there's many windows that can be open just to open up and bring that outside air in. When you do that, it's effectively like almost moving outside in terms of the number of air exchanges. So you really cut down on risk. If you have younger children who aren't vaccinated and eating with their masks off, those windows open, that makes that a very safe environment. Physical distancing, that's one of the things that we've seen in terms of the guidance here in Minnesota, no longer required. And, when we go back and look at sort of the research and what we're learning, those indoor spaces, again, being farther away than 6 feet apart may not matter as much as we thought. So, you know, obviously exercising caution, making sure that people who aren't symptomatic aren't close to others that they're being tested. But if you're not symptomatic and if you're wearing a mask indoors, physical distancing really probably matters less. Outdoors, we do know that the risk of transmission is really low. So we don't need masks outdoors, and physical distancing won't be necessary. And again, vaccine access for those under 12, that's something we're looking forward to in the future. Pfizer and Moderna are planning to submit their research to FDA in either September and October, and it's taking about 3 to 4 weeks once FDA receives that research to go through and make those vaccines available to that new age group. So that's the time frame that we're looking at right now to open up vaccines in those in the 2 to 11-year-old age range. And with that, that's a picture that I took a few years back when we were up at Wolf Ridge, but a beautiful, still warm August evening, I think. But with that, I will open up to questions. And I think if you want, you can put them in the chat.
Folks, again, as he noted, you can put them in the chat and we'll monitor and keep track of them and do the best we can. Question for you, Ben. Will kids under 12 also be able to go without masks outside if they wish?
Yes. Yeah, no, great question, Michelle. And the answer to that, and Pete, correct me if I'm wrong, but is yes. I think when you and I chatted, we recognized that outdoors is recognized as safe now.
I think as one of the things early on that we stopped doing was rock climbing, because think of at the time we were concerned about all the sharing of surfaces and the close proximity of people. Well, now we'll be able to open windows, we'll be masked as we'll be indoors, but we're still going to be able to rock climb now as we return to reopening. Ben, question, how do you manage symptom monitoring once a program has begun?
Yeah, no, I think that's a great question. I think, and Pete, you and I chatted about this too. Having a group leader check in with whoever is on campus or whoever is in their group in the morning, and it doesn't need to be real formal. We don't need to be taking temperatures, but really checking in. How are kids feeling? Do they have any symptoms that are consistent with, what we would start to what would be COVID? MDH has and created at the beginning of the last school year a really good flow chart that kind of calls out, what are primary symptoms, what are secondary symptoms, and I think that flow chart's been useful for the K-12 schools over the last year. And I know, Pete, you're planning on making that available and using that as part of the plan for Wolf Ridge reopening as well. And so following that flow chart's a good model to figure out when somebody may need to be tested.
True. We've worked with our local county health department here. I know there's some folks on the call or on the Zoom this evening who run their own facilities. And I can tell you for Wolf Ridge, one of the sources we've leaned on besides Ben has been our local health department. Their health inspector is here every year inspecting our kitchen, our lodging, so they know us well. And I think for anyone running a facility, that's a source we leaned on, both to understand what's available locally for such as testing, also for people who really know our facility well. And it's Dr. Miller, and that's been our crew that we've worked with for Wolf Ridge advice. The idea that family camp will be run like it was in previous years. Melissa, I'll take that one. I think Ben can answer that one. And the answer is yes and no. One of the things that will be the same is setting up a list of classes through the week and having some sign-up ability. And we were anticipating that we would have to limit those classes a bit more, and things like rock climbing wouldn't be available. That is changing fast. And so we are anticipating that the normal array of classes will be there. One of the things that, for example, we heard from the Shea family that won't occur is Wolf Ridge is not open to regular summer camp this year. That was a level of congregate gathering that at the time when we had to make those decisions of bringing all these unrelated people together into shared rooms, not being able to have the volume of people that we decided not to do. As such, we don't have counselors. So there won't be counselors that'll be joining the families in that sort of manner and support, is what you heard from Matt and Shelley Shea. But there will be seasonal naturalists that are here, young, passionate people who are great role models for children. And then I think family camp as a whole, it's families who have that outdoor ethic, who are role modeling for each other. Where did you go on vacation? How did you deal with your kid in diapers when you're out on the canoe trip? Those sorts of things that I know families really get a kick out of while they're gathered at Wolf Ridge. If close contact outside isn't considered a problem with the virus, will Wolf Ridge be open to the public for using the trails? Thank you, Carly. Yes, is the answer. That Wolf Ridge has been closed, and as you arrive at our gate, there is still a closed sign, but once we start to go back to residential, then the facility will open up as well. The rules will be the same, that outside is very safe, and go for it as you come inside masked, and we'll stay that way for a period of time, and we ask visitors who are coming onto our private property to please check in at the office. Ben, the question, could you talk about how the transition between different groups of occupants will be managed for sleeping areas where presumably nobody is wearing masks? Is that managed by ventilation or extending the amount of time when rooms remain vacant between changes of occupancy? That during this whole period of June, we are blessed with a very large facility and not many people coming to attend. And so we have the ability that there won't be a turnover of occupants from one room into another, for example, that occurs in a short period of time. And so that those sleeping areas, that the transition will be lengthy. In part, we just don't have we haven't built up a large cleaning staff yet. And so we need time to be able to turn over those rooms and clean and disinfect, et cetera, before people come in. So there won't be a quick turnover at all that in between changes of occupancy. And that yet, as Ben mentioned, we're blessed with very modern buildings with very good ventilation. Plus, all of the windows in all of the rooms are openable. And so there's the other advantage that given the summer, we're going to be in a good position for that. Ben, you want to take the next one? If a camper or student tests positive while at Wolf Ridge, what would be the plan? Because you and I have talked about this.
Yeah, I think, Pete, yeah, we have, there are going to be some isolation spaces made available depending on, the ability of that camper to safely get home. There's other considerations that have been made. If that camper's parent is there, is fully vaccinated, they can transport that camper home. Again, CDC guidance tells us that if you're fully vaccinated and in close contact with someone, that person who's in close contact doesn't need to quarantine. Again, recognizing that these vaccines are protective, again, is a conservative approach, recommended that, the parent mask in that particular situation. So the goal would be, and Pete, correct me if I'm wrong, but to get that camper home in a safe manner, but also make sure that there's adequate time to have them picked up and brought home.
And for example, Michelle, again, this is where for the entire summer at Wolf Ridge, we will never be at more than about 50% occupancy at best. And so the ability to isolate of someone will be pretty easy. Wolf Ridge has also bought quite a number of N95 masks. And so if someone needs to go in and to monitor the camper, to take them someplace, things like that, that they can go in with a higher level of protection, a tight fitting, well-sealed N95 mask to help do that. And of course, prioritizing wherever possible, if it is parents or a group leader, a fully vaccinated person doing that sort of work. Ben, what? Oh, yep. I think we've caught up with all the questions. Yeah. That one of the questions, Ben, I was wondering about a Mike Osterholm term, and people in Minnesota have often followed that. Of your thoughts on hygiene theater? What is that, and what does that mean, and how does it relate here?
Yes, I think Mike was referring to really that kind of shifting science that talked about the risk of transmission from surfaces, versus kind of the airborne transmission and our miss there, especially at the beginning of the pandemic, and thinking about ways that we could really reduce risk. And I agree uh, with him. I think we were overly focused on cleaning protocols to begin with, especially when we probably did have some of that information. Again, if we go back to that choir outbreak early on, and some other ones too that happened in Asia. But I think you have seen really, and just being out in public, right? We've seen a lot of those cleaning protocols at many of the places that we go, be that big retail stores or restaurants or things like that, really dialed back. Some of the things that are good to keep in place, physical barriers, especially as we reduce some of that physical distancing. If somebody is symptomatic and they're actively symptomatic, obviously we want to get them tested. We want to get them isolated if need be, but those are the kinds of things that can still provide some protection, especially in those indoor settings. So cleaning maybe is not as crucial as it used to be, although again, I will go back and as a public health professional, always tell people to wash their hands frequently and well.
Carly asked, will visiting public be required to test within 72 hours of arrival becoming to visit? And the answer is no, that the requirement through June for those coming to Wolf Ridge for a test or proof of vaccination. So if you're vaccinated, you're good. And if you're not, then to get a COVID test that is within a few days prior to arrival at Wolf Ridge, and of course to arrive with a negative test. For people that are doing more day use programs, and we've actually begun some day use programs here at Wolf Ridge already. We haven't been doing residential. We've had some local schools up here for a variety of things where we're outdoors. And so that outdoor element and the visiting public isn't generally hanging out in our buildings. We're not having our open house this year that we often have in June. And so some of those programs where public might come on site and into buildings, we're just not doing. And so the public coming in, the most extent that they would have is coming to check in the office where we're behind a shield. We've got good open windows, that no test will be required for that sort of visit to Wolf Ridge. But residential, there's the difference. Again, thinking about that at Wolf Ridge, and certainly in any environment, our greatest risks are going to be in the lodge, where you're hanging out in the rooms, or communally as you exit those rooms inside the building, or over in the dining hall. And those are experiences that are happening residentially. And even for some of the day use groups, local schools, they're bringing their own lunches, for example, that we're doing, and that's all done outdoors, and it's been going well. Other questions? This is great, Dr. Miller, thank you. Then, I think with that, I may take it from there as we're getting near the end of the hour. And I really want to say a tremendous thank you to Dr. Ben Miller, who is with Prairie Creek from Connection of Parent and Roles, Michelle Martin, teacher at Prairie Creek Community School in Northfield, Matt and Shelley Shea, longtime family program people, and a number of folks that I saw in here that are also family folks, Witherspoons, who have been coming, I know that name, have been coming for a long time. Beth, a number of folks in there, so thank you. That it's really great to have people here this evening, and it's such a heartwarming thing to be talking about, and to hear from people that know we want to get kids back learning in this environment. It was actually quite interesting. I was speaking today with the legislative director for Senator Tina Smith, and we were talking about that the country needs trusted institutions that are training centers for people to learn how to live more lightly on the planet, to live more in depth of connection. And Senator Smith and Klobuchar, actually, we've been talking with, they're going to do some support possibly to help Wolf Ridge with their Making Waves campaign and see what they can do. But it was heartwarming to hear, even in perspective from national leaders, how institutions like this and families like the Shays and teachers like Michelle and parents and board members at schools like Ben Miller really are critical. That before we end tonight, I'm going to pass it off to one last person, Russ Bierbaum. Before I do, I just want to mention that next month, Shell Smith, who's one of our board members, thank you, check the chat. Next month, the focus what a great segue from tonight. The focus is going to be on birds and bird migration. And Wolf Ridge is a bird breeding hotspot, not just of Minnesota, but truly of the nation. That northeastern Minnesota is remarkable that way, and Wolf Ridge has a long history. Birds is actually the most commonly requested ecology class by school teachers, parents, families, etc. Wolf Ridge has a tremendous history, one of the most long-running bird research stations in the country, and we're going to be banding birds next week. You are going to see live birds in hand getting banded, learn the science behind it, and I'm not going to guarantee it, but you could see a hummingbird being banded. So Joe Valesky's nodding. So there's your teaser for next month's Zoom series. And yet note it is on a Sunday. We purposely did it because we're looking at the ability to maybe pull kids in who aren't doing homework right now or things like that, and pull families in. Sunday, June 27th at 12 noon. With that, I'm going to give you to Russ Bierbaum, the chair of the Wolf Ridge Board of Trustees. And as he talks, I want you to note a link that Shell Smith just also put in the chat. Russ.
Thank you, Pete. Thanks to Shelley, Matt, and your family and all the great stories. We've shared them in person earlier, and thank you for sharing it with everyone on the call today. Michelle, your stories about teaching and the methodology that Wolf Ridge's teachers use is right on the money. Is exactly what our mission to teach kids and get them enthused and excited. Ben, thank you for your great consultation with Pete. We had a recent board meeting, and Pete presented to the board the protocol for reopening. Little did we know that much of the concerns that we had were going to be removed. A year ago, we were sitting here wondering what is going to happen. We knew the 50th anniversary was coming up. How are we going to celebrate 50 wonderful years of Wolf Ridge? And things looked bleak. We were hurting for finances. Everything 12 months later is, I wouldn't say totally reversed, but getting close. It certainly feels much different than a year ago, and we're excited to reopen. And I know the board and the staff are committed to reopening safely with Ben's help and all of the staff. We would not be doing this if we did not feel it was going to be safe for everyone who's attending. This past year has been a great year for Wolf Ridge to kind of sit back and reevaluate our priorities. How do we present our lessons in a different way, virtually, as it turns out, or Joel going out to a school in person and getting them to learn outside. A wonderful story about the little desk you're building down at Prairie Creek. What a great idea. There's got to be a market for those somewhere, I would think. But a lot of great things have happened. We are committed to reopening with a stronger program, maybe a little different, but better. And we're taking it step by step. And those of you who may have donated money to help us weather the financial drought, thank you so much. We're doing pretty well, actually, with the help of many of you who are donors and others that are not with us tonight who have donated. And I have to say, thanks to the federal government. Not often do we get to say that, but in this case, they have been very helpful to us in weathering this storm. So with all of that, those positive things happening, we're excited that we're going to be back in business again very shortly. And we hope in September, we'll be back to almost normal, or maybe normal. And we've got kids, parents, and teachers that are eager to get back up to Wolf Ridge. If you've been to Wolf Ridge, you know why they're eager to get back. So thank you very much for joining us. Good night.
Thanks, Russ. The chat that we put in, the link there is the giving page to make a donation and support Wolfridge. I added for Sandy, who is a school teacher at Prior Lake Savage Schools, about the fall. Great question. We are planning, and in talk with Dr. Miller, we are planning full occupancy. And at this point, we're not anticipating any significant restrictions by the time we hit the coming school year. And I can tell you that is remarkable because that is not the case across the country. I was on the phone today with residential center leaders like Wolfridge from Seattle, and centers like Wolfridge do not have any expectation of opening in the fall, and that areas in Washington are struggling right now, actually going the opposite direction with their COVID conditions and increasing restrictions, where I feel fortunate to live in Minnesota, that folks have taken it seriously. Our vaccination rates are high, and look what we can start to restore back into society and for our kids and our families. I thank everyone for attending this evening. Thanks to the hosts. And I forgot earlier, a thank you to North Star Resource Group and Fortune Financial, who are sponsors, who have given financial donations that have helped us to be able to do this series throughout the year. Very much appreciated. That again, next month, in late June, June 27th, bird banding, bird migration, and the hotspot of birds that is Wolfridge. Thank you, everyone, for a great evening. Enjoy the leaves. Like Wolfridge Joe said, we're just getting leaves up here. I realize some people are probably a full leaf out. Enjoy the warm weather, and I look forward to when you can join us back on top of the hill here at Wolfridge. Thank you very much.